Introduction to Diabetes Mellitus. Welcome to this series on Diabetes Mellitus. In this video, we'll provide an overview of diabetes, what it is, how it is classified, and why it is so important to understand. Let's dive right in. Definition of Diabetes Mellitus. Diabetes mellitus, or simply diabetes, is a group of metabolic disorders characterized by high blood sugar levels over a prolonged period. This occurs due to either inadequate insulin production, resistance to insulin, or both. Classification. Diabetes can be classified into several groups: Type 1 diabetes mellitus, Type 2 diabetes mellitus, Gestational diabetes, and other rare forms like drug-induced or monogenic diabetes. Each type has different cause, risk factors, and management strategies. Epidemiology. Globally, around 463 million adults were living with diabetes in 2019, and this number is expected to rise to 700 million by 2045. Type 2 diabetes is by far the most common, making up about 90 to 95% of all cases. Pathophysiology overview. In type 1 diabetes, the immune system attacks and destroys insulin-producing beta cells in the pancreas, leading to an absolute insulin deficiency. In type 2 diabetes, there is a combination of insulin resistance and progressive beta cell failure, resulting in a relative insulin deficiency. Clinical presentation. Symptoms of diabetes often include the 3 P's: polyuria, polydipsia, and polyphagia, meaning frequent urination, excessive thirst, and increased hunger. Other symptoms may include unintentional weight loss, especially in type 1, along with fatigue, blurred vision, and slow healing wounds. Diagnosis of diabetes. Diagnosis of diabetes is based on blood glucose levels. According to the American Diabetes Association, a fasting blood glucose of 126 mg per deciliter or higher, a 2-hour plasma glucose of 200 mg per deciliter or higher during an oral glucose tolerance test, an HbA1c of 6.5% or higher, or a random plasma glucose of 200 mg per deciliter with classic symptoms can confirm diabetes. To summarize, diabetes is a group of disorder that results in chronic hyperglycemia. We covered its classification, pathophysiology, and how it's diagnosed. In the next video, we'll take a closer look at type 2 diabetes, its risk factors, progression, and treatment strategies. Don't forget to like, subscribe, and hit the bell icon to stay updated.